Good day. Good day and welcome to NAC TV's Coffee Chat. My name's Lyle Watson, and on this episode of Coffee Chat, we're going to be talking with our guest about the month of November. And it's a month that has been set aside to bring our attention to men's mental illness. And we've had a situation in our community in the past couple of weeks that has brought it to everyone's attention, our mental health and our well-being. And I'm pleased to welcome our guest, Reverend Chad McCharles, to Coffee Chat. And thank you, Chad, for taking the time to join us.
It's an honor, Lyle. Thank you for asking.
Well, and I know that you've had some long days and nights thinking about men's mental health and what's happened in our community. And as we go forward, I think I would like to start with, what was your feeling of the impact of the tragedy that happened in our community? How did it affect the family, the friends, and the community as a whole?
The impact is far-reaching, and I would say the ripples from that are going to be felt for a long, long time in this community. Not only because the family was very well connected, continues to be, not only because of the individual's wonderful personality, but there's a nature in small community where we are all connected in real ways, tangible ways that you just simply don't have in urban centers.
Yes. And
because of that, no matter how closely associated you were with the individual, you feel it, you're impacted. And that means, for a while we need to be gentle with each other. Because we're all feeling it in different ways, to varying degrees, all of which, when you sort of gather that up, shows a massive, sort of incalculable impact.
Yeah. And it was certainly felt wherever you went in the community, you could feel it. The other thing, Chad, is you did a outstanding job of bringing the love of the community, the love and support of the to the family and their friends. And there was something about the way you explained and talked about love and the strength and the power it has.
I'm always aware, every Sunday in the pulpit, but especially in situations like that, where you're called in as clergy to pastor and support a family in a time of tragedy, that there's a power that carries me. I'm keenly aware that I can't say or do anything apart from the power of God. And I don't say that in a way that, singles me out as clergy, because that same power is in all of us. And it was so evident, as you remarked, in that hall, the Yellowhead Hall, at the funeral, standing up, praying for the words to come that would bring comfort and some degree of peace in an awful situation. Standing up, looking at the crowd, realizing then and there that it was the individual's life that had gathered us, and the impact that was had on so many was felt there. And so we took just a moment at the beginning of that service to acknowledge that power in the room and to express to the family in a very quiet and yet real way they were not alone. And it sort of makes the hair stand up on the back of your neck.
Yes, it did.
When you speak about that and when you experience that. And I am an advocate for small communities for this very reason.
Yes.
Because this town has gathered around this family and others in the past, who have experienced some tragedy or another, and brought about real healing in a way that only small towns can do.
Yeah. And we can be thankful and blessed that we live in a small community like Neepawa and be proud of it. We're talking about the month of November, and it was set aside quite a number of years ago and become known as Movember. It started out where men were to grow mustaches or become unshaven, and to bring the fact of the stigma that surrounds men in particular about talking about their mental health. And have we seen an improvement in the communications about the stigma surrounding mental health for men?
There's a funny dichotomy, Lyle. We communicate very well. You know, everything is about communications these days. And communications come faster than they ever have before, with technology. And we have programs and, innumerable resources to communicate about such things as mental health, men's mental health, whatever it may be. And yet, even with all of that, the stigma remains, which is a mystery to me. And yet, when we really look at human nature, or man's nature, the nature of a male, we are told and we tell ourselves that somehow we're supposed to be strong and macho and all of those things.
Yeah.
And therefore, it's not acceptable for us to be weak or what's perceived as weak. And that was something, again, that I really wanted to communicate the day of the memorial, but today to our viewers, that, if a life is taken by another illness, such as cancer, we say cancer took them from us. And yet with mental illness, we have this lie that is so pervasive that they took themselves from us. And I refute it, because it is as much a struggle as is any other, physical illness, if not more, because of the stigma that's attached. 11 people every single day die of suicide. That's in this country.
Yeah.
That's unreal. 4,000 deaths a year attributed to suicide. It's the second leading cause of death among young adults 15 to 34 years of age. Second, Lyle. And if you think about the pervasiveness of cancer today, that makes that statistic unimaginable. It's 3 times higher in men. So you take those statistics and times them by 3.
Yeah.
And so you start to chip away at why November or Movember or a month for men's mental health is so essential to get us talking.
Yep. Well, it's certainly, the tragedy in our community has certainly got a lot of conversations going. And I'm just going to touch on a personal note for a moment, if I can. In our family, we have experienced suicide. And as I talk to a lot of people in the last couple of weeks, I find out that there's a lot of families that have been affected. And at a family gathering this past Sunday, we had an open discussion about suicide, mental illness, and Judy and I, my wife and I, have experienced firsthand mental depression within our family, and the anxiety and the depression that leads and where it leads to. And our son went through terrible times recently, but from the time he was growing up, he suffered anxiety, depression. The point I want to make is that at this point in time, and we had a lengthy discussion on Sunday about this, the thing that saved him from his suicidal thoughts was the fact that he was able to open up and bring it out and share. And he was pleasantly surprised at the support and he got from friends and family and people he's never even met. And it helped him shed that stigma.
Yeah.
Do you experience that same situation in your profession and when you're talking to families?
Absolutely, Lyle. I often come into a difficult situation with a family, whether it's at the time of death or at a time of a difficult health diagnosis or injury or whatever it is, and just make very clear, sort of put it out on the table. I'm not here with any magic answers.
No.
As a priest. And sometimes that's the perception, But what I am here to do is listen and to share the load. Because a load shared is a load halved. If we truly are able to unburden, as you say your son was. And, I've sat here as a small town boy and touted small towns and their strength and all of that. And yet, even in urban centers, you can find small community, by reaching out, talking to people, sharing your story, making a space for them to feel safe to share their story. And then suddenly, you're sharing one another's burdens. And that's community.
Yep.
And you ask if in my profession, but also in my family, Lyle, I'm not ashamed to say 2 people very near and dear to me. One who is not with us anymore, one who is. Both attempted suicide in my lifetime that I can remember.
Yeah.
And I was younger than I am now anyways, but old enough to recognize what that was. And at the time, the stigma around it meant in the family, we did not talk about it. It was only in recent years when we started to open up and talk about it that we realized, actually, it's not only our family, but the neighbors over there, they've been touched by suicide. And, so-and-so that we know, they've been touched by suicide. And that comes because we opened up, right? And it's in that sharing that we find comfort and strength.
Yep. And Chad, if you and I, as we sit and chat today, if we can help one person, and that the ripple effect will maybe carry on, and that is our goal and our object here today. Mm-hmm. The thing that I find interesting, and I encourage men to shed that stigma and feel the freedom to open up and talk about their mental challenges, whether it's anxiety, depression, whatever. But when we look at our community, a small town, there are many avenues of communication open to us as men if we take the advantage of it.
Right.
I think, the church families, we have several church families in town. And like you say, you're there to listen. We have organizations like the Men's Shed, for example, where the sole purpose back in the 1980s was to form an organization that welcomed men in to be able to communicate their feelings and lessen their burdens when it comes to mental health and, in some cases, suicidal thoughts.
Yep.
And that movement has spread worldwide now, and we have a branch here in Neepawa. So that's available. There's the drop-in center, and where people gather and participate in events and just take time to be together and to talk. Do you know of some other examples you probably know of?
Any of the service clubs.
Yes.
Are, at their core, they're about relationship.
Yep.
And relationship and community are, they're what fight against isolation and mental health struggles and a sense of being alone in our struggles. It's an interesting thing to ponder, in this day and age where the service clubs, the churches, and the traditional ways, I use the word traditional lightly, but that we would be connected, are crumbling and being turned away from in droves.
Yes.
And it compounds the mental health crisis, especially for all not just men. And it's because we're busy and we're at the rink and we're here and we're doing this and we commute to work or we do whatever. Lots of good reasons not to be involved in those social communities, those relationships.
Yep.
And yet, all of those things that we turn away from are opportunities to be connected and to find strength from one another, which, leads me to something that came as I was struggling myself to know how to help this family recently. We often think of someone who is suffering from mental illness as having something wrong with them.
Yes.
That somehow their chemistry in their brain or their genetic makeup or the environment that has formed them, all of that has equaled that they are not right.
Yep.
And yet it is so obvious to me that what isn't right is our society, our world. That's what's broken.
Yes.
And yet here we are as individuals fighting, rallying against that, because we know in our hearts, our souls, our minds, our bodies, things aren't the way they're supposed to be.
That's right.
There are pressures pushing and pulling, against us constantly. And we know that's not how it should be. And our body reacts with anxiety and fear and depression. And yet something's wrong with us.
Yep.
And
the whole world situation is just a real catalyst for anxiety at this point in time, and it's getting worse as I see it.
Quite right. On our devices, which we all have in our hands, in our pockets nowadays, are an endless stream of anxiety and fear. Sources that remind us things are not right.
Yeah.
And yet we look at each other and look at those who are suffering from mental health illness and say, wow, something wrong with them.
Yep.
And yet it's so backwards.
On that point of something wrong with them, Chad, I want to bring up the topic of judgment.
Mm.
And I think at some point in our lives, it would be fair to say we're maybe all guilty at different levels of judgment.
We are.
But what has happened and what has been displayed in this community in the last couple of weeks has made me stop and reflect on we never know what that other person is going through unless we can talk.
Exactly. Communication.
Yeah.
And relationship. Key to breaking down those misconceptions, those barriers. And judgment is a big piece in my line of work.
Yeah.
Because oftentimes folks will express a distaste for their perception of the church judging them.
Yep.
Whether it's because they're divorced or there's been adultery or mental illness or whatever, the list goes on, things we get ourselves into.
Yeah.
And in the past, the church has been very good at judging on all of those fronts. And yet, as I study Scripture, which may come as a surprise, is not my first inclination as clergy. Something I do by necessity, every week for messages and to find a source of strength when I'm in a time of crisis or in crisis with a family. But in all the time I spend in God's Word, what comes through way more clearly than any sense of judgment is that there's nothing that can separate us from God's love. Nothing that we can do, nothing the world can do, height nor depth, power, angels, demons, none of it, that can separate us from God's love for us, including suicide.
Yeah.
How could suicide somehow be exempt from that list of there being nothing that can separate us from God and His love for us? It just doesn't work that way.
Yeah.
And in fact, the Bible is crystal clear that even suicide is not a sin that is enough for us to somehow receive eternal judgment. The only sin is turning away from God permanently. That's the one that breaks the relationship, and that's our doing.
That's our doing.
And that's the spiritual side of it.
Yep.
Obviously,
Yep.
in my line of work,
Yep.
that's always a part of it. And try to convey that in a secular way. And it can be done, and we've been talking about it.
Mm-hmm.
Community, relationship, communication. Break it down. Don't allow it to be kept in the shadows and hushed and secretive. This family who has suffered this tragedy, the one thing that they have asked for is to keep the conversation going.
Yes. And if you and I can help and aid in any way to do that, that's one of our ambitions today, is to do that, to keep the conversation going. Thinking in terms of, you mentioned some statistics there, that men's suicidal rate is 3 times higher than women's. Now, women suffer the same mental anxieties and depression as men, I would assume, and yet they can talk about it. And that is their savior, and that's what cuts that statistic down.
Yeah, and somehow, and we are our own worst enemies. I think you and I can both agree on that.
Yeah.
We tell ourselves as men to bottle it up and shut it down, and not to express that we're feeling sad or teary or whatever, angry or whatever it is. It's not seen as acceptable for us to express those things, and that's a deeply rooted thing in our culture. Which makes it all the more important for us to have these conversations.
Now, in terms of age of our general public and society, is there a specific age group that are more susceptible to suicide crises?
Yes. And it's a sad statistic because it fits with the tragedy we're all still feeling here, age bracket wise. 45 to 59 is the most dangerous age for men in particular. And we're very flippant in our society about talking about a midlife crisis.
Oh yes.
Someone buys a red Corvette and they're in a midlife crisis.
We've heard that.
And we do see it expressed around us, and some of us may be nearing that stage, and some of us may have come through that stage, and we weather it differently, all of us. And yet, at the core of those labels, such as midlife crisis, there is this truth, age 45 to 59, 50 to 60 roughly. Is the most critical age. And it's that age bracket that suffers from suicide the most.
Oh, that's I have to stop and just think about that, because I am well past that age, Chad, but I can relate to what they referred to as a midlife crisis. Was it a crisis of mine, or was it a crisis caused by something else?
Right.
I can't honestly answer that, but I've been there and done that. And it's not pleasant. Not pleasant.
So something to look forward to, you say?
No, it's not something that you jump up and down with joy and say, "Oh boy, I'm getting to this age. I'm going to hit my midlife crisis." No, it's a very mindful time of life where you have to look after yourself.
Right.
And on that point, I think I would like to discuss the fact that it's okay to look after ourselves. And with your experience, can you express your thoughts on that and looking after ourselves first?
Self-care. Again, something men are typically poor at, because we are cultured and raised to provide and help with the raising, in terms of providing for the raising of a family or whatever it is. And so oftentimes the care of ourselves gets a back seat. From a biblical standpoint, from a spiritual standpoint, God is very clear. Love the Lord your God with all your heart, with all your mind, with all your soul, and with all your strength. This is the first commandment.
Yep.
The second is like it. Love your neighbor as yourself.
Mm-hmm.
So in that equation is the essential piece that we will love ourselves and therefore be able to love those around us and to love our God.
Yep.
And in that equation is a balanced approach to life. But an essential building block of that is loving me. And that's sometimes the hardest.
Yep.
Because I know the most about me. Warts and all, ins and outs and all of that.
Yeah.
And sometimes we focus on the shadow side, the darker side of me, because we're keenly aware of our failings. And yet we're called to love ourselves. How we do that is very different for everyone, right?
Yep.
Some people do it through physical exercise, sport, out in the fresh air. Some people do it at a wood lathe, like the men's shed I think of.
Yes.
Some people do it with numbers, looking after their books and whatnot brings them some comfort and peace. Travel for others, reading scripture for some, cooking, eating.
Yeah. Yeah.
There are so many ways to care for me, and yet I can't tell you what would be best for you to take care of Lyle.
Yeah.
But I have an idea of what works for Chad.
Yeah.
And to be aware of those things and attentive to what brings light to our soul. What makes us feel a little spark? What makes us feel calm and safe? And to nurture those things.
That calmness is a key factor of it all. I was just thinking about self-care, and I think as individuals, we all recognize the fact that we should be doing things that satisfy us mentally, physically, and spiritually.
Mm-hmm.
And if one of those three are missing, there is a balance there, is there not?
Mm-hmm. And we are very good at attending to one or two of those things, but often we're very poor at attending to all of them.
Yeah.
And it is trying to find a balance. That is the trick.
Yeah.
And yet without attending to all of those things, we are imbalanced, and we won't find health, let alone mental health.
Yeah. Just on that note, finding that balance, there are people, whether it's men or women, but we're talking more about men. There's a large portion of our population that does not attend church services or don't belong to a church, and yet there is a way of being spiritual without attending church. Am I right in that?
Absolutely. For that reason, I feel closest to God, and this is spoken, as a priest, someone whose job it is to, encourage people to come to church. I feel closest to God when I'm outside.
Yeah.
When I'm walking. Walked a couple of miles south of Tim Hortons here the other day, down through the conservation corridor and, south country road. The conversation between me and my maker comes so easily then. Or if, I'm in a forest with a canopy of trees over me, or by some body of water, with the waves lapping. Those are the times that I feel so connected to the Creator.
Yep.
Church and worship, essential pieces to any spiritual life that we're taking seriously.
Yes.
But to be spiritual and to feel connected to God and enriched by the divine can come any place you feel that sort of grounding, that connecting.
I just want to share this with you and our viewers. I've had an experience of working with Circles for Reconciliation and Indigenous people. I've done a fair amount of studying, reading, and associating with the Indigenous culture. It's an amazing culture.
Truly.
One of the first, one time that I felt closest to our Creator was in their hot tent, when they stoke up the coals and you're enclosed in the darkness.
Sweat lodge.
Sweat lodge.
Yeah.
And you're sitting there with a pair of trunks on the earth. And the elder introduced the gathering as a time to be connected to the Creator above, with nobody in between, and the earth below us that we're sitting on. Mm-hmm. And that every time that I get on calm or anxious or have some depression, I think about that, and I too go outside and connect with earth and the Creator above, and I do get a calmness from that.
Absolutely. And I've always said that our life as the church, as church goers, people who gather in a particular place in a particular way on a Sunday or whatever day it is to worship, has to be an extension of that personal, spiritual connection.
Okay.
So to come to church and expect that connection just by coming over a certain threshold into a space that's been designated for worship, there's a lot of disappointment there, often, because we don't encounter what we expect to. Because that time of worship needs to be in response to that which we're feeling wherever we are, grounded and connected to the divine.
Yep. Well, as usual, Chad, we could talk for another half hour,
quite
but
easily.
The time does slip away on us. And I think I would like to close our program with giving you the opportunity of sharing some closing thoughts with us on the discussion of men's mental health and suicidal crisis.
Mm-hmm. Closing piece has to be, and this is going to be a bit typical, so I apologize, probably what you expect. But if you really knew me, this isn't what you would expect. There's a piece in Jeremiah, book of Jeremiah from the Bible, where God says very clearly, I know you. I know every hair on your head. I have known you since before you were in your mother's womb, and you are mine. And in that knowing, there's a vision of how God sees us. And God knows our struggles. He knows when our mental health is suffering. He has been right there with anyone who has taken their life in a tragic way. And that does not change God's love for them. As we talk about mental health and suicide and prevention, and November as a time to keep the conversation going, we must be prepared to do that for one another. And so whether it's a text or a phone call, or if you're in crisis, call 911. It's the easiest thing to remember. Connect with someone. I can't be stressed enough.
Well, thank you very much, Reverend Chad, for taking the time to be with us today and sharing your thoughts and some of your experiences with us. So thank you very much, and we look forward to talking to you down the road. I'm sure we'll meet again.
Thank you, Lyle.
Yes. I have a couple closing thoughts that come to mind, and I'd like to remind all the men in our families, in our community here, extended families, wherever they may be, if in fact you feel a need or would like the opportunity to talk to somebody, please feel free to reach out. and drop that stigma that surrounds us talking about mental health and suicidal crisis, and reach out and talk to a lot of the organizations that we mentioned here today. There are quite a number of them in our small town, and just reach out and talk and share the conversation. And I think you'll be pleasantly surprised how many people would like to have the same conversation with you. Anyways, until next time, stay healthy and stay happy. My name is Lyle Watson. Have a good day.